So just to give you all an overview of what we'll be talking about today. So I'm just going to give you an overview of the counseling program here at Trinity. Introduce you all to the KCREP standards. So KCREP is a big thing. We just received our KCREP accreditation, and we'll talk more about that. Just kind of going over the curriculum as far as the counseling program here at Trinity, the different specialty areas, just in the field of counseling. What professional practice looks like as far as the entry-level clinicians, which will be our students, what practicum looks like as far as expectations, what internship looks like as far as expectations, and even the qualifications in order to be a site supervisor. We'll talk about the evaluation process, just kind of how assessments are done in the program, both for the students as well as the supervisors and the faculty and just the program in general. The governing organizations and what ACES-informed counseling looks like. And then I'll give you all opportunity to ask questions as well. So just to kind of look at the graduate counseling program here at Trinity, so we offer two different degrees. So we have the clinical mental health program as well as the school counseling program. So the clinical mental health program is more so geared towards licensure. So when you're thinking about obtaining your LPC or your LCPC in Maryland, those students will be taking the 60-credit program. All of our programs are 3 years, so it's kind of set up as 2 years of coursework and then 1 year of the actual clinical sequence when the student is out in the field doing their practicum and internship. Students are also doing they are doing some coursework concurrently, but there are certain classes that they would have to have completed prior to entering practicum and internship. So we offer two different types of school counseling tracks. So we offer the traditional 48-credit school counseling program, as well as the 60-credit school counseling program. Some of you all have some of the urban youth track. So the urban youth track is a little bit different. So of course they're taking the additional credits that kind of puts them on the track towards their regular like LPC licensure. So they have the opportunity to get both their school counseling license as well as their LPC. And those are also 3-year programs. The interesting thing with the school counseling urban youth track is the fact that the students, how their internship is kind of broken up. So they do the semesters that are actually during the academic school year, as far as like the K-12 setting, those sequences are done within the school setting. And then during the summer, just because of the difficulty in trying to obtain those hours, those students kind of go into an agency and are able to work with children and families in the agency setting. So they're able to get like a multifaceted experience with working with children and families. Okay, so we've been talking a lot about KCREP, and we're kind of celebrating our recent accreditation. So this is like a big deal. I actually went through the Trinity Counseling Program. At the time, the program was just KCREP aligned. So that meant that all of the coursework was like in alignment with the actual standards. So the KCREP is the Council for Accreditation of Counseling and Related Education Programs. So it basically denotes a commitment to program excellence. It ensures that all programs, whether you go to a KCREP program here in the district or if you go to a KCREP program in Alaska, that you're going to get the same coursework, the same information, just to make sure that there's fidelity throughout the field. So accreditation comes via self-study and an external review. And so me and the professors were working on that over the past couple of years as far as the self-study, but just identifying all the information, all the knowledge, all the skills that they're instilling inside the students, as well as just the wealth that we have as far as our coursework. And just kind of like proving to like an external group of people, like, okay, no, Trinity knows what they're doing. They're making sure that they're in alignment with the standards as well as the other counseling related programs. Last semester, they actually had the external auditors come in to really, get a feel and understanding of the program that Trinity offers. So they interview students, they interview former students like graduates, they interview faculty, they sat in some of the classes. So the focus is on acquisition of both knowledge and skills in the field of counseling. And the KCREP accreditation just ensures that students are eligible for licensure. A lot of times, especially now, the American Counseling Association is shifting more towards pushing for KCREP accredited programs. And when I was completing my master's program, that was the issue in the past, was ensuring as you were applying for licensure that the different boards were willing to accept the classes, because they may not have had the same names, even though they had the same information or same type of instruction that was being taught. Even certain sites, when students were looking for internships, they would not accept students unless it was from a KCREP accredited program. So like, for instance, the VA administration was one of those sites. So now students have opportunities to apply to some of those, places that weren't available to them in the past. So just kind of looking at the KCREP curriculum. So these are the different courses that all KCREP programs um, teach. So just kind of looking at professional counseling, orientation, and ethical practice, social and cultural diversity. Especially here at Trinity, we focus a lot on the multicultural piece, human growth and development, career development, counseling and helping relations, group counseling and group work, assessment and testing, and research and program evaluation. So when we just think about the field of counseling, so according to KCREP standards, we have different specialty areas. Of course, we said that the focus here at Trinity is more so the clinical health counseling and the school counseling, but other programs offer addiction counseling, career counseling, clinical rehabilitation counseling, college counseling, and marriage and family counseling. And so that just ensures that the students are even taking the courses here, because all of those courses are offered here. And the students also have the opportunity to do some of their, they can choose to do their practicum internships at a site that offers it, as long as they have the supervision and they're getting those direct hours. But just making sure that the students, they're aware of the history of these different areas, that they're aware of the different theories, the different principles, that they understand the different roles. Like, for instance, addiction counselors may, they could be in a private practice, they can work in an agency, they can work in a residential facility. So just kind of really understanding the different areas and different specialties. And also, what does practice look like, and the different techniques that may be relevant to those specific areas. Like, for instance, doing biopsychosocials, or having an understanding, if you're doing addictions counseling, of the different types of substances that your clients may be addicted to. Okay, so as we transition into professional practice, so this comes from Section 3 of our KCREP standards, just ensures that each program provides for the application of theory and the development of counseling skills under supervision. So these experiences will provide opportunities for students to counsel clients who represent the ethnic and demographic diversity of their community. And I believe that's so important to hear, especially in the District of Columbia, and having some of that overlap where you're able to go into Maryland or go into Virginia, and understanding that even though your clients may look like you, there's so many other factors that are involved, and just the diversity that this area offers in terms of the client population. So looking at entry-level professional practice, so this is speaking towards the students as they're entering their clinical experience, as they're starting their practicum, or as their internship. So of course, each site offers, or each site has their own requirements that students may have to fulfill, whether it's doing a background check or whether it's doing TB skin tests. But these are some of the basic standards that the students have to fulfill while they're in internship and practicum. So making sure that they have their liability insurance, and keeping up with it. So we encourage our students to join American Counseling Association, because one of the things that we really focus on is kind of building or establishing your professional identity, and being active, and of course, in the different organizations, both at the national level and at the local level, ensures that students are aware of all the different opportunities, different trainings, different resources that are available for them. So of course, in going through ACA, they have I believe what, after they graduate, it's discounted, but as a student, they actually get free liability insurance that they have to maintain throughout their time in the program. They have to be able to do audio or video recordings, or live, as a type of live supervision of student interactions with clients. So if the site is unable to allow students to either audio or video record their sessions, the supervisor will need to come into the site and actually observe what those interactions look like with between the student and the client. So ongoing evaluations of the student performance, and those are both summative and formative. Students need to have increased familiarity with professional activities and resources, and that kind of goes along the lines of really, establishing and having a professional identity. And then, of course, students should be able to obtain individual and group counseling skills while they're in the internship phase and practicum phase. These are some of the forms. I'm sure you all are familiar with them, especially if you've been working with Trinity for a while. This just kind of speaks to the midterm and final evaluations that you will complete for each of your students, just to kind of show their growth throughout their clinical experience. So in looking at practicum and what supervision looks like, so during the practicum, and this is kind of new with KCREP, so during the practicum semester, students are only able to get 100 hours. So before, you were able to just kind of stack your hours and roll them over into the next semester, but now that we are accredited, you can only do 100 hours during the practicum semester, and that's over a minimum of 10 weeks. So that would be like a summer session. Generally, our semesters are 16 weeks. So what that looks like is 40 direct service hours. So that's those face-to-face interactions with the clients, whether they're leading group, co-facilitating group, doing individual counseling, check-ins, just those face-to-face interactions with clients. And if you're working with children, of course, it could be with their families as well. Those indirect service hours come from the more administrative tasks. So whether they're doing trainings, whether they're doing the paperwork, or even when they're here at class, because they have a class that runs concurrent with their practicum and with their internship. So the papers that they have to do, completing their logs, that all counts towards those indirect service hours. So throughout practicum and internship, students are required to do weekly supervision. So it can be individual supervision or triadic or group supervision. Supervision is usually done by a faculty member. In some programs, we don't offer that at Trinity, but doctoral students who have gone through a KCREP accredited program, or a site supervisor is able to facilitate that individual or triadic supervision. So students average about 1.5 hours per week of group supervision with a faculty member or doctoral student supervisor. And so they not only do they check in with you all at the site, but they're also checking in with their supervisors, their faculty supervisors here at the university. Okay, and just kind of speaking towards internship piece. So upon completion of practicum, students enter the internship phase of their clinical experience. So over the course of the 2 semesters, they have to accrue 600 hours. So in order for them to graduate, they have to have 700 hours. Internship students, they accrue those 240 direct hours. So those are the face-to-face. And 120, so it looks like 120 each semester. So that's 180 in terms of the indirect hours per semester. And just in order to be eligible for practicum and internship, the students have already taken a lot of those foundational courses. So they've already taken their research classes, the intro to counseling, theories, techniques, career, multicultural, diagnosis and treatment, ethics, and group. So for those classes that they have to have a minimum of a B in order to enter practicum and internship are theories, techniques, ethics, and group. So those are like the key areas. Now, one of those classes can be taken concurrently during the practicum semester. So I spoke a little bit about triadic supervision. I know there's not a whole lot of discussion or information that's out there. That's something that's kind of introduced more so at the doctoral level as far as counseling. But triadic supervision, it's 3 people, the supervisor and 2 of the student interns. Generally, it starts off with a check-in about 10 to 15 minutes just to kind of see how things are going at each of the sites, just to kind of process. The supervisor has a choice, so you can use the session either to focus on one student, or you can divide the session between the two students. So as one student is presenting his or her audio tape, the other student is given a focus area. So maybe the professor or the supervisor tells them, okay, I want you to focus on, your peers' technique. How was their reflection of feeling? How were they attending the client during the session? Or even times for case conceptualization. Okay, so where do you see yourself taking the session next time? Or where do you think you'll start the session next time? What kind of check-in do you need to do with the client in the future? Once the student is finished presenting, the other student and the supervisor are able to give feedback. So just kind of looking at the qualifications in order to be a site supervisor. So of course you have to have a minimum of a master's degree in counseling or a related profession. So it could be social workers. In the past, they've used psychologists. I don't believe we have any psychologists at this time, so we're more so focusing on just LPCs and LIs. You have to have relevant certifications or licensure. Usually for our program, we're more so looking at licensed clinicians. A minimum of 2 years of professional experience. And that, of course, you would have to have fulfilled that anyway just to be licensed. And just kind of knowledge of the program's expectations, requirements, and evaluation procedures, and also relevant training and counseling supervision. And I know that kind of varies as well by state. Like, for instance, in Maryland, you have to have an additional credential in order to be a supervisor. So just kind of thinking about the importance of maintaining ongoing communication between faculty and site supervisors. So of course we're having the orientation now, but just ongoing consultation, professional development opportunities will be provided in the future between the program and site supervisors. I've had people reach out to me this semester. There are trainings coming up to make sure that I'm sending that to our students. So feel free if you feel as though there's something that you would love to see training students at, or just something that you think that would kind of help to build their repertoire. Feel free to send it to me so that I can post it on our listserv and vice versa. Um, One of the important things, especially at the beginning of the semester, are written supervision agreements. So kind of creating a supervision learning contract, making sure that the student, the site supervisor, as well as the faculty supervisor are all aware of the different roles and responsibilities during the practicum and internship experience. Of course, if you're having an issue, and I've been in communication and I've had the opportunity to meet some of you all, but if there's an issue, feel free to reach out to me. You have my contact information, and just ongoing discussions with your students about risk management. Help them to kind of think about self-reflection. And I kind of spoke to that earlier when I mentioned, just because someone looks like you doesn't mean they have the same experience. And I had the opportunity during one of my doctoral programs. I was working during my doctoral program, during my internship there. I was working at a site that focused on children in Southeast, and that was one of the things that my supervisor at the time really wanted me to be aware of, even though, because my background was elementary education, I had been teaching in that area in the past, I had my master's and work with adults in this population, but just making sure that you're reflective, making sure that you're paying attention to even your body language, or how certain things you may say may come across to certain clients. So just kind of, encouraging students to be aware of that. Challenging students to take positive risk. I receive a lot of emails from students who may be in a situation where it's a new site and they're afraid to work with the population, or maybe there's a counseling skill and they're not sure how to implement in the session, or even theory. And trying to identify what their professional or theoretical orientation is and how to actually implement it in the session. So allowing the students to have those conversations with you and supporting them and taking the steps or taking the initiative in a safe and structured environment to do those things, and just ongoing continuous assessment. Okay. So just kind of looking at evaluation in the program. So that comes from Section 4 of our KCREP standards. So it includes opportunities for counselor education program faculty to comprehensively evaluate overall program effectiveness. Assessment of students' knowledge, skills, and professional dispositions is integral. So just kind of looking at what evaluation looks like in the program, and we'll talk about that as far as the assessment of the students, but just kind of keeping aware of those 8 core areas and making sure that the students are showing that they are successful or have mastered those areas. Ongoing measurements of student learning. So that's more so done here at the university, but that's also done in the field as well. When you all are identifying certain areas of concerns, and maybe it's not just skill related concerns, but maybe it's their professional disposition. Maybe this person is, MIA when they're supposed to be somewhere, or maybe they're, they're coming in and they're not dressed professionally, or they're not attending the different trainings, and just our ongoing analysis of the data. So even for the assessment of faculty and supervisors, so students are encouraged and are given the opportunity to evaluate faculty as well as their practicum and internship supervisors. So more so with the faculty is after courses, students are given the opportunity to rate the course, rate what their takeaways, what they feel as though they may have gained from the course, as well as their interactions with the faculty. This is the form that is given to students to rate their practicum and internship sites. So not only does it, provide like the more Likert scale, but a more narrative form, just kind of get their takeaway of what their experience was like. So professional disposition is a key area that we focus on as well, focusing on fairness, diversity, reflection, responsibility, and advocacy. Those are the key things that we're measuring with the professional dispositions, and we measure those at multiple points in time as the student is in the program. And the data that's used as we're evaluating the students kind of determines whether the student needs to repeat a course, whether the student needs to be dismissed, or if the student is actually being successful within the program. So just kind of looking at the transition points for professional disposition. So transition point 1 is during those initial advisement meetings when we're trying to determine whether or not the student is ready for graduate level work. Even in the past, when you think about, for instance, like writing examples, and we know that we're preparing these students to go out into the field, and they have to be able to write scholarly but professionally. So maybe the student needs to take a couple of courses at a community college before, just to kind of get their writing up. Or maybe it's auditing some of the courses first, just to kind of see maybe there's been a huge break between their bachelor's program and their master's program, or maybe they have a master's in another field, and just trying to get themselves acclimated to being back in the school setting again. Transition point 2 takes place following the completion of introduction to counseling. And then the third transition is the year 2 of the student's scholarly experience after they have 24 credit hours, and that's after they have completed group counseling. And then transition point 4 determines whether or not the student is actually eligible to even begin the practicum or internship experience. And of course, like these aren't as concrete. We still kind of meet to see what's going on. Even with the students who may already be in internship too, we're still doing check-ins to make sure that the student doesn't need to do an extension semester, make sure that they're actually eligible for graduation. And we kind of spoke about this as far as the professional identity. So these are the national organizations as far as counseling that we more so subscribe to. The students are well aware. They pay their membership to be a part of these organizations. So the American Counseling Association and the American School Counselor Association. This is where our ethical guidelines come from. So if there's something that comes up, and I know that we have several supervisors or social workers, but if something comes up, I think it would be helpful to not only have the students look at the counseling ethics, but also comparing the social worker ethics as well, just to kind of see what that looks like and the different maybe overlap as well as differences between the two fields, so they can kind of get an understanding of what their role is. Another focus for Trinity's counseling program is ACEs informed counseling, which are adverse childhood experiences. And so once you all have a hard copy of this PowerPoint, there is a link attached to this image by Dr. Nadine Burke-Harris, who it's a TED Talk, and it kind of explores and discusses what ACEs are. So you're just kind of thinking about whether a client as a child was exposed to either physical or emotional abuse or neglect, any type of sexual abuse. Was there mental illness in the household? Was there a family member or a parent who was incarcerated? Any substance abuse in the house, even the marital status of the home, and what that looks like as the child grows up and reaches adulthood, and just understanding the different outcomes, whether it's associated with somatic issues such as like obesity, diabetes, cancer, even stroke or heart disease. Understanding the different risk factors as far as maybe they're sexually promiscuous and now they have a risk factor for STIs, or maybe there's drug use associated, or maybe there's alcoholism, and just really helping students when they're working with clients and they're required to do a case conceptualization in the classroom, but really helping them to really process like what's going on with the client. Yeah, you have this client who is in her 40s and she's presenting with headaches every day, but what is it? Is the headache associated with, just like maybe she has high blood pressure, or does it go back to, okay, no, this is a somatic issue that's presenting as if a psychosomatic issue that's presenting as if it's just a headache, but there's more to it, and where did it start? I also want to take the time to extend the invitation. So each year, Trinity offers or hosts a social justice colloquium. So this year's theme is seeking social justice and advocacy, being trauma-informed and responsive through a transformative and interdisciplinary approach. So it will be held here on April 25th. So there will be programs, whether there's lectures, poster presentations throughout the day. And as the time gets closer, I'll be sure to send you all an invite and give you all more information about the day. Okay. Were there any questions? Okay, well, I want to thank you all for attending today. I'll be sure to send you all a hard copy. Again, if you have any questions or concerns, you can reach out to me via email or here in the office. My number is 202-884-9563. And I appreciate you all. Thank you so much.
Thank you.
Thank you. Have a good day.
Thanks so much. You too.
Bye-bye.
Thank you.
Thank you.